taking prescription pain pills for 10 days make you a drug addict? Since 1999, the legal opioid prescriptions have quadrupled, and these medications are mainly used for the treatment of pain. And one of the most common causes of pain is back pain, with low back pain being the #1 cause of disability worldwide. Now, most people are used to taking some over-the-counter, like aspirin or Tylenol, when they have some pain. And when the pain gets really bad, they go to their doctor and they get a prescription for the pain. The most commonly prescribed opioids are things like oxycodone, hydrocodone, codeine, morphine. But a lot of time, the pain goes away only when they take the opioids, and they have to keep taking the pills to keep the pain away. And the pain can sometimes get worse because the person feels great after taking the drug and does things that the pain would normally prevent them from doing, things like yard work or exercise or whatever caused the pain in the first place. Opioids, they are in the same class of drugs as heroin, so they are very, very addictive. In fact, here from the CDC, it says 1 in 5 become long-term addicted users of opioids after just a 10-day supply. So that's not that long. What's worse is that when they can no longer get opioids legally, they turn to heroin. In 2014, there's a study with 94% of respondents of people being treated for opioid addiction said that they chose heroin because prescription drugs were far more expensive and harder to obtain. So what are some better options than prescription pain pills? Well, earlier this year, the American College of Physicians here, they recommended spinal manipulation as a form of treatment for back pain before taking any kind of medication. And the Federal Agency for Health and Research Policy recommended people with low back pain choose conservative care first, and recommended spinal manipulation as the only safe, effective, drugless form of initial treatment for acute low back pain in adults. And for those of you guys that don't know, spinal manipulation is the medical term for a chiropractic adjustment. So basically what we do here. So what we do, we are very, very good at treating back pain. If someone is taking medication for back pain and they might have addicted to opioids or other prescription drugs, or they're having a hard time getting off there, have them give us a call. It's a very serious problem. That says here that drug overdoses 2015, over 52,000 lethal drug overdoses. So it's real important that we get these people off the drugs and get them feeling better so they can get back to life. So have them give us a call. We'll do a free consultation. Thank you.